Health insurance can be confusing, especially in the United States. While most services provided in SHA are free, anytime you go off campus for an appointment, there will be fees that you will have to pay. This video will go over some basic terms that are important to know. To keep it simple but give you tangible numbers, I'll be using the Student Health Insurance Plan from 2025 for some examples. The first thing we're going to go over is something that is important to know before you select a provider. In-network and out-of-network. You'll generally want to see someone who is in-network with your health insurance plan. In-network means that the insurance company has a deal with these providers about what is covered and how much the insurance company will pay for that specific service. Insurance company will pay more of a bill for an in-network provider. You will pay less. Out-of-network provider means that the insurance company does not have a contract with these providers. Insurance companies will pay less, and some plans they'll pay none. You'll end up paying more. Some of the terms I will be mentioning will have different amounts depending on if the provider is in-network or out-of-network. An example, the student health insurance will pay 80% of a bill for an in-network provider, and you will pay 20%. For out-of-network providers, the student health insurance covers 60% of a bill and you pay 40%. You can always call and check with your provider to ask if they are in-network for your insurance. You can also check on your health insurance company's website. The next important term to know is copay. A copay is the amount that you pay a provider at the time of service. You may have to pay a copay for each visit to your doctor. For the student health insurance, you will need to pay $20 every time you go to the doctor, as long as the reason for the visit is covered by insurance. Fun thing about copays is that there can be different copays for different things. There can be a mental health office visit copay that's different from a physical health office visit copay. For the student health insurance, office visits for mental and physical health are the same at $20, and ER visit copays are $150. Check your specific plan for your various copays. Deductible. The deductible is the amount you pay before your health insurance begins to pay. Some visits have this and some do not. For example, if you're on the student health insurance, the deductible doesn't apply for an in-network doctor's office visit. Instead, only the $20 copay applies, and the $20 you pay does not go towards the deductible. However, any labs or procedures done in the office would go towards that deductible. I like to describe it as this. The copay is what you pay to see a doctor. The deductible is what you pay if the doctor does anything. Now, this deductible amount starts over each plan year. This means you must pay the deductible each year before insurance will begin paying. For the student health insurance, this is August 14th, but most other plans are calendar year, which means they start over on January 1st. The student health insurance deductible for in-network providers is $250. For out-of-network providers, it is $500. In-network and out-of-network deductibles are separate. This means if you go to an in-network provider on the student health insurance, you will have to pay a $250 deductible. If you've met that deductible but then go to an out-of-network provider, you would then have to meet the $500 deductible for that out-of-network provider. So let's talk about a deductible using the student health insurance. If you have a $1,000 procedure, you must pay the $250 deductible before insurance will begin to pay their portion of the remaining $750. That remaining portion falls under coinsurance, which we'll talk about next. But just know that you'll have to pay the deductible before insurance will begin to pay their end. If you have surgery, your hospital could be in-network, but the surgeon could be out-of-network. They bill health insurance separately. Sometimes you'll have 4 bills, one for the hospital, one for the doctor, one for the anesthesiologist, one for lab work. Don't let this catch you off guard. Coinsurance. Coinsurance is a certain percentage that must be paid after deductible. This payment is for covered services only. You will still have to pay a copay. Now, I just used a lot of words, so let me use an example. The student health insurance covers 80% of in-network bills after deductible. You must pay the $250 deductible and then 20% of whatever amount is left. The 20% is the coinsurance. On our $1,000 procedure, the provider is in network. You'll have to pay the $250 deductible. That leaves $750. The coinsurance that you're responsible for is 20% of that, which is $150. So the insurance company will pay for the 80% or $600. So on the student health insurance, a $1,000 procedure with an in-network provider, you would end up paying $400. Insurance would pay $600. What if we had the same example, but you've met your deductible? When you meet your deductible, that means that you've already paid the $250 for something else. In that instance, insurance would pay $800 and you would pay $200. Okay, but what if this procedure is with an out-of-network provider and that you haven't paid anything towards that out-of-network deductible? Insurance would cover $300 and you would pay $700. If you had met your out-of-network deductible, then insurance would pay $600 and you would pay $400. See how this can get confusing? And I haven't even shared if you owed only part of your deductible. What I just went over was some of the very basics about health insurance. There's a lot more, and it can be overwhelming, so please know that SHAW is here to help. For more information, you can always visit our website at www.grinnell.edu/SHAW, or you can visit our Instagram or Facebook pages.